sleep disturbances, lack of motivation, so that they commonly describe it as a few things. The tenets that I look at, because I approach it in a holistic way. I'm not, there's some people who are using androgens to boost their athletic performance, but they're actually already athletes. These are not, normal members. It's not like me taking steroids and then going and trying to run. There's something called a negative feedback. So the brain looks and says, oh wow, there's loads of testosterone, I don't need to keep stimulating them. So the testicles shut down.
Hello, and thanks for tuning in today. This week's episode is brought to you in conjunction with Upskilled and their mini MBA. If you want to get the skills and knowledge to help move you forward without all of the big expense, then this mini MBA with Upskilled is the right way to go. Follow the link in the show notes and you can get $500 off. Zak, welcome to the Career Clarity podcast by Second Wind. Good to have you here.
Thank you for having me.
Now, Zak, what's going to be fascinating about our conversation? I know typically we talk through the career clarity from an athlete's perspective. What's great about what you're going to bring to this conversation? And again, I think, as I said, just as we were chatting earlier, I'm ready to learn a lot from you. And there's some things that so apologies if I really delve into places where like, that wasn't what we were going to be talking about. But hopefully we'll have a good chat and everybody will learn a little bit.
Yeah, definitely. I'll be happy to kind of give answers to everything I know about, and yeah, hopefully it helps some people.
Yeah. Now, so Zak, I guess I'm going to let you introduce yourself and talk a little more about what your specialty is, so that everyone who is listening and watching can, basically come along with the journey with us. So please give us that quick intro, who you are and what you're up to.
Yeah. So my name's Zak Zafrani. I am a UK-based doctor. My official kind of background is in general practice, so family medicine. I have a specific interest that I've developed recently, or not recently, but over many years in sports, regenerative medicine, and more so in men's health and testosterone replacement. And I think there is a very good link between all of that. And in different parts of my career, I've seen the interplay between all of these aspects of what I do. I really enjoy what I do. Medicine is beautiful. You get to help people, but you also get to tailor it to assist people that you kind of have a link to. I've got a massive love of sports, and I always try to tailor my career to what I like to do.
Well, that's good. And I think tailoring to what you like to do and where your passion is definitely a big theme that resonates across many of the episodes and guests. Now, we'll come a bit more into your background and sort of some of the story, but I just want to pick into some of those words or phrases that you said. You talk about testosterone replacement in men, and what does that mean, or how might we sort of interpret that or come across it in our sporting world?
So if we look at we're talking about testosterone deficiency. So testosterone is an androgen. It's a men's hormone. It's also in women as well. I mean, we both genders have it, and it can be impacted by many things. Specifically in sport, there is a lot of data being looked at about endurance athletes, any sports with risk of concussion, head injuries. These are all things that can cause testosterone deficiency later on in life. Also, energy availability. The training for elite level athletes is pretty high. So the body has less likelihood to focus on things like hormonal balance rather than just athletic performance. So this is the issue that we do come across. Also injuries and certain things like that. Now, testosterone itself is a general male problem. So if we talk about deficiency, to keep an eye out for the symptoms, it's the same for an athlete as it is for just a normal member of the public. So general deficiency syndrome symptoms will be things like sexual dysfunction, so erectile dysfunction, lack of morning erections, and lack of libido. Those are the common ones. And if you think about it, men tend to not really be I mean, it's getting better, but they tend not to want to talk about these things, and this is where the stigma is. So, sexual dysfunction is a big aspect of it, but also more common symptoms, and this is where people get a bit lost in TD, as we call it. Fatigue, lethargy, lack of drive, motivation loss, lack of concentration, like that. They call it brain fog. So you just that fog of not being able to think clearly and losing clarity of mind. And unfortunately, men then say, we're getting older. It's all right, I'm in my 40s. And then I look at it and think, 40's not old. You can't, this is not normal. And that's where they come to somebody like me.
Thanks for yeah. and so what you've described there is for me, it's quite interesting. Testosterone deficiency, does occur with men. I want to understand then this intersection with sport,
Yeah.
and how those two pieces align, because in my mind I'm thinking, well, this must starting to come along a bit of a borderline here between what's competitive and what perhaps starts to break certain rules and things like that. And there's a lot of talk about enhancements, and certainly in the sports that I like enjoying. So I'm interested to understand a bit more about that intersection with sport and what you're seeing.
So within sport, so if I give you a bit of data just to kind of prevalence, I like to look at prevalence. So how frequent is it? And if we look at prevalence data, there was some studies done and they looked at around 180 to 200 athletes, and they found 12% had severe deficiency, and further 18% had what we call mild deficiency. And if we go off UK guidelines, you would combine them, because both of those are deficiencies, and that is a marker under 12 nanomoles of testosterone. So within sport itself, it is quite prevalent, and I came across this in a very interesting way. My interest in testosterone peaked because I was doing sports clinics for a treatment. I see athletes to do PRP, which is platelet-rich plasma, for injuries. And some of them were saying, I can't recover as well as I used to. And these were, kickboxers and other athletes who had officially retired, but they still wanted to continue training because it was part of their life. And it would come up, and I'd always just say to them, what kind of symptoms are you having? And at that point, I wasn't working in men's health, so I would then ask them to go to their general practitioner. And then they would always come back and be like, I got batted away. They weren't interested. They just said, we're not interested in doing the blood tests. And this is where then a lot of people went into the private market to get it. Now, the difficulty you do have is that's talking about retired athletes. Then you talk about...
To get what, Zach?
Yeah.
To get what?
To get blood tests. Because initially, symptoms are one kind of part of testosterone deficiency, but also to get the serum testosterone level done, because you can't have a diagnosis without both. And that's where it's...
Yeah, okay.
This is where, if we look at another pet peeve of mine, which is influencer marketing and stuff from certain influencers who talk about testosterone. And there's a new trend called testo maxing, which is, just, your testosterone's normal, maybe have a bit more, you might feel a bit better. That's doping. That's not replacement. This is not a medical issue. So you need both. Some men do run lower testosterone because their receptors are more receptive to androgen. So that's normal. For example, me and you could go get testosterone levels done, and officially UK guidelines 12 and below is normal. You might have a testosterone of 28 and it might be fantastic. I could have a testosterone of 12 and still have no symptoms and be completely healthy and be able to train and recover. So it's dependent on person to person, and symptoms are really important. So in terms of athletic performance, you've got to be careful, because you can't just take testosterone to amplify your level, even if it's at the top level of normal, because you can find out. There are means of checking the other hormones to see who's actually doping versus actually being treated.
Yeah. And so do we see many athletes with a natural deficiency in testosterone whilst competing, or is this something that, you mentioned it might be more with aging athletes, people who used to, whether they were doping or not, but who are used to having a certain level of testosterone and seeing that dropping? Is it so? Where does this lie? Where are you starting? Where's sort of your main sort of base case of individuals that you speak with?
I'll be honest, it's less frequent in younger athletes, and it happens more so towards the latter end of the career. Now, there could be many reasons for that. Again, there's a lot of research and data that needs to be looked at in this group of people, because a lot of the answers we don't know. So this is all hypotheticals of what I see and what I've kind of dealt with. You do see it happening more often in aging athletes. The question is that because as we get older, our reserves change. As we know in most sports, as you get towards your 30s and things, depending on what sport it is, you tend not to be able to compete to the same level as you did in your 20s and earlier. So maybe, injuries, use of painkillers, there's so many things that fall into it, and there's too many different causes that we can look at, and at the moment they're just all there. But it tends to be more towards the latter end of careers and generally after retirement or stepping down.
Hi, I want to take this moment to thank Upskilled and their mini MBA for sponsoring this week's session. One of the great things about their mini MBA is it allows you to gain the skills and knowledge to help propel you that little bit further forward. It gets you understanding the vocabulary in the room and also gives you some of those skills to navigate the corporate career, the government career, or indeed stepping into not-for-profit. So big thanks for Upskilled and the mini MBA for sponsoring this week. And hey, check it out. Link in the show notes. You can get $500 off. And so, okay, you would see athletes getting the injections, PRPs, yeah, and that's where they're practicing athletes. Is that sort of those examples? So they are individuals who talk about, or at least verbalize, things that could be linked to a reduced testosterone that kicks in.
Yeah.
We're going to have people coming towards the end of their careers, men and women, but those who are listening to this. And, well, you mentioned those symptoms before. Tell me what those symptoms are again, because I'm then interested in, well, what should they be doing about it, and if anything at all?
So the general symptoms of TD, testosterone deficiency. Yeah. Generally, most people the ones they tend to notice most are lethargy, fatigue, tiredness, sleep disturbances, lack of motivation. So that they commonly describe it as, I want to go and train, I want to do things. Even in business, some athletes post, competing and retirement, they'll start business ventures and they're just like, I have no drive. I want to, but I have no ability to do it, no motivation, can't concentrate for long periods of time. And then if you kind of delve into it, it's a sexual dysfunction, which is that sits in the background, and they'll be like, actually, yeah, that's true. Comparatively to maybe 3 or 4 years ago, my libido's gone. I don't feel like myself anymore. And that's where it's about having an open conversation and knowing what to look for.
You talk there about that former athlete who is a few years out of retirement, who is thinking, I don't have the drive, I don't have the passion for this. Isn't that just psychological? Why isn't it just a psychological feeling of, well, I used to love playing cricket and football, and now I'm not doing that at that level anymore, and running this company is just boring for me.
Yeah, that's definitely a thing. It's like the whole thing about athletic identity. When you have people who train to an extremely high level, they're very well known for certain things. It becomes their whole identity. And this is something you're fully aware of, and this is where there is life after. It's a career after a career, really, and it does play a massive role, because we know that. And sorry, one thing I've completely kind of forgot about, which is mental health issues, which is another thing that is actually a really big sign of TD, testosterone deficiency, is anxiety and depression in men who have never felt it. They'll just suddenly start developing it and they think that it's normal. So mental health plays into it, because we know, for example, that there is a lot of contributing factors. So in an athlete, for example, who's retired, loss of that drive to say, I'm not doing this anymore competitively. They'll get stressed. They won't have the urgency to want to do it. Their cortisol levels will spike, their stress response levels. That dampens your testosterone production. And then you're not sleeping well. That again impacts your testosterone production. So there's so many lifestyle factors and psychological factors that play into this, that it's why you have to take a very well-rounded look at an individual as themselves, and each patient is kind of catered to based on what they tell you, rather than a one size fits all.
And you know that, so what's fascinating listening to this is, you know, my focus has pretty much always been on the, I'm going to say, psychological, and perhaps then the physical, as in be active.
Yeah.
You know, you're taking this to that chemical level within us, that sort of said, well, there's something else that perhaps you ought to take a look at, as certainly as you're coming off sports.
Yeah.
So then what sort of activities should they be going and doing, or would you recommend in order, well, actually before that, are there ways to maintain a testosterone level? Is it something that individuals can do? You know, men can be doing either whilst playing or competing, or indeed afterwards. What you know, positive, or what's the word, proactive action can be taken to maintain testosterone, or at least slow down the growth, the decline?
I think a lot of it is to do with energy expenditure. So it depends. It's sport specific. So it depends on energy expenditure. Sometimes what tends to happen is you find that as you're younger, you tend to push it a lot more, and your body's able to recover. But there is only so much reserve before it starts to cause difficulties. So I guess it's one of the things that I'm a big advocate of is get your testosterone levels checked, because unfortunately what we do as men is we'll check it in our 30s and 40s when we start feeling something, and you have no idea what your testosterone level was when you were 22. So because you were fine. So I'm seeing it a lot more in the work I do, not even with athletes, just general men in the UK have now started to get this idea of, do you know what, I just want to know because I want to see where I am now. And I love that. That's where I think most men should be. Just even in athletes, just midway through your career, start of your career, just get your testosterone levels done. And if we look at there was actually a study done on like Olympic athletes, I think it was. They looked at like 15 sports, and there was a huge data sample size. I think it was around 700 Olympic athletes, and they looked at during. So this is competitive athletes at the time, not retired, and they found that they found around 25% of them had some element of testosterone deficiency, and this was during competing. So they were, you know, actively training, etc. So the question really is that's quite high in my mind. Even if you compare that to the general population, that percentage is pretty high.
What's the general population?
Nowhere near that. I mean, it wouldn't be anywhere near 25. I mean, in diabetics, it's around 25%. And in pre-diabetics, but in the general population, not.
25%. Oh, okay, without going too crazy and extrapolating across every Olympic male, but Olympian 25%, and I'm just going to say that at elite sport level, 25% of men have some form of testosterone deficiency. Right. Given that, what should athletes be doing if they realise, hold on, I've got tested. It seems as though I've got lower levels.
Yeah.
Am I even allowed to do anything about that?
That's difficult because there's a lot of issues with utilizing testosterone. Now, if you were an athlete and you were found to be testosterone deficient in some sports, and I know more of as a fan. I follow MMA quite a lot, and I know that in mixed martial arts promotions, there were times when they were allowing cage fighters in big promotions to utilize testosterone for deficiency, but it got a bit out of hand. I don't know whether this. I don't know what the actual rulings are in the intricacies. I don't think it's allowed anymore because there's this grey area. You can get a deficiency diagnosis, have it, optimize your levels, and then it's classed as doping. So there's a lot of stuff that goes on in the background. But in terms of what an athlete can do, if you're an athlete and you're looking at your numbers and you're like, okay, that's pretty low, or it's lower than I'd expect. The question you got to ask is, I'm an athlete and I'm training quite heavily, so that's going to diminish my reserves anyway. That's something you can't really do anything about. So I mean, you could optimize your training to maybe reduce intensity slightly, but again, because you're competing at that level, you can't do that. So if you take that parameter out of the way, you then focus on the other tenets of what improves testosterone. So you've got to focus on things like sleep quality and sleep health. So I'm big on sleep tracking. I've got a tracker. I track my sleep, and initially when I started looking at it, I thought it was just a new fad, and it actually this was like years ago, and I've been doing this for years. It works really well in terms of sleep depth and quality, improves testosterone numbers.
Okay, all right, that's the link. So getting the sleep in this instance, that can help
Correct. Yeah.
testosterone levels. Well, can it help them increase?
Yes. Yeah. So
Is that what we're saying? So it can actually increase testosterone levels as well.
correct. So there's a few things. The tenets that I look at, because I approach it in a holistic way. I'm not, there's some people who work in testosterone replacement are very heavy-handed with testosterone. But my thing is that testosterone replacement, ultimately when you're deficient, ends up becoming a lifelong thing. And my plan is not to put a man onto testosterone replacement until they've done everything. So weight reduction, so reduction in body fat percentage is amazing for increasing testosterone. Doing some form of resistance training, fantastic. 3 times a week. It doesn't need to be significant amounts. Sleeping better, eating better with a high protein diet. These are all things that is known to improve testosterone.
And these are things that I suspect a lot of athletes are doing, and especially those
Correct.
coming towards the end of their career might be eating better, sleeping better, doing those types of things to try and live that healthier lifestyle to prolong their sporting career. I think what you're adding, to me at least in this conversation, is another angle to look at is, well, get your testosterone levels clear. So you have, well, I'll say a base, but it's a base from whenever it is that you took it, be it, it's probably towards the end of your career, in my mind. And then you can start to learn from it. So I guess quite, perhaps more bluntly. So do you have people who have come to you asking you to support a sort of a doping plan in some shape or form?
Not specifically with pro level, because it's a very intricate area to play with. I've had retired athletes who, I've got case. So my background is specifically I dealt a lot with powerlifters and strongmen because I competed in that area in the amateur like many years ago. So I have a lot of links to that area of sport, and I do get like retired or coming to the end of their career masters levels. Like strongmen who will come in and see me for injuries and also for testosterone replacement. So in that situation, when you're at a higher level, it's very difficult to get cleared. So it tends not to happen. It's usually after retirement. And in these athletes generally, they tend to come out of competing, for example, they retire and then they try to carry on at the same level because it's built into them. They've been doing it for 10, 20 years. Like, I need to train like this. And it's that discussion to say, listen, the identity has changed. You're now a former athlete. You need to figure out other things to do, change the way you train, reserve energy, and just maintain kind of longevity more than anything else. And that's a difficult conversation. But yeah, we there's been cases of there was a gentleman, and I can anonymize like kind of as a case study just to give the listeners an idea. I had he was probably a very good level like semi-pro tennis player. He did really well, around 38, so not really doing any more like anything competitive, but he was playing 4 or 5 times a week. And he came to me, and this wasn't in my men's health clinic. This was in the in general practice. This was in NHS work. So he came to see me, and he was like, "Doctor, I'm on antidepressants." I'd never met this guy before, and he's like, "I'm on antidepressants. I feel like it's doing nothing. My life is terrible. I'm self-employed. I set up a business. It's failing." And he's having a long discussion, and I was listening to him, and I was looking at his history, and I said, "Did you ever suffer with depression?" And he's like, "No, started 5 years ago." And I was like, "Fine." I was like, "How have you been with regards to sports and recovery and things?" And he was like, "Oh, I can't play tennis. I'm bored. I just don't have the drive. I can't. I'm so tired after I play that I don't play anymore." And he's like, "My libido's gone. My energy's completely drained." And then the more he spoke, I was like, "Let's do your blood levels." So we checked his testosterone, and lo and behold, he was deficient quite significantly. I referred him on the NHS at that point to a hormone specialist, and he was commenced on testosterone replacement. Saw him and his wife 2 months later, and his wife came in and said that for 5 or 6 years, she felt like his lights were just switched off. It was not the same man she knew throughout her teenage years and like in her 20s and stuff. They've been married for a long time. And she was just like, he's back to himself. She was like, I thought this was just an aging process. And he came back and he told me, I'm back playing tennis. He's like, I feel fantastic. My libido's back to normal. My business is thriving. He goes, because my motivation and concentration has skyrocketed. Now, that would be, the poster boy for testosterone replacement. I mean, it's not that same for everybody, and it's not going to do that for every single man, but he was truly deficient, and it impacted his life so beautifully. Like, to see this is what I kind of work for, which is those sorts of conversations with family members and patients. So it works fantastically when it is required. And again, he was already doing all the other tenets. He was eating well, he was sleeping as best as he could. So yeah, I mean, it's good to hear these kind of stories.
Yes, it is. And like you say, the poster child of testosterone replacement and that sort of therapy or that approach sounds like it can have benefits. And look, it's not something I'm sort of very well versed in, or in, maybe it's my age, or maybe it's the people I'm hanging around with, maybe it's just not spoken about as yet.
Yeah.
Do you find then that it is perhaps more prevalent than we realize, and it's more once you see your doctor and talk to them, suddenly you realize actually more of my friends are probably doing this. More former athletes, certainly in my case, may well be following this path.
There is there's two sides to this, and I do a lot of work around kind of breaking the stigma. There's two stigmas here. One is on the side of men in general who, understandably, don't really want to kind of talk about these things. Unfortunately, like in a society where you're told not to really talk about certain things, so men will kind of hide things like sexual dysfunction, which is understandable, and we know this. We know this in medicine, but on the other side of things, there's a stigma around, especially in the NHS in the UK, which is that we're not as forthcoming to treat. And I don't know, I look into why that is, and sometimes it is the maybe not knowing as well. Is testosterone replacement and deficiency talked about enough amongst doctors? Generally, if I kind of give you an oversight of just colleagues of mine, if I was to mention testosterone to them, they just kind of roll their eyes and like, oh, this is just people wanting to take steroids. And I'm like, no, it's not. It's the same compounds, but this is not steroid use. It's completely different. This is a medical treatment.
For many athletes, so the enhanced games are getting more and more noise, right? And for many, it's been outrage that athletes would take this, because it's almost it's not almost, it's a thing that most don't do, right? I'm not taking drugs. I'm not going to do that. This can happen naturally. I went for a run today. If I do a 6-minute kilometer, I'm like, it's because I'm older. I can't go. I can't do 4-minute kilometers anymore. I could never do 3 minutes, some things. So I'm like, I can't do that anymore. Isn't it just because I'm 47 and I've just got to live with it?
Yeah. I mean, there's a lot to that. There's a lot to unpack within the mindset of people. And the enhanced games, I find it interesting, because when I speak to even colleagues within testosterone deficiency and in the field, I have a very different outlook to it. I come in knowing a lot about testosterone use in sport, and unfortunately there is, in some sports, that there is use, and I'd come across it many years ago in terms of other people that were competing that used it. So I'm aware of the uses of it. But the enhanced games are interesting. I find it very interesting to kind of look at, both from a medical.
I think it's interesting. A medical, okay. I do think it's interesting. Tell me from a medical perspective, what makes it interesting?
I just find it amazing, because the thing is, if you look at enhancements, so these men are obviously enhancing their testosterone, etc., and using androgens to boost their athletic performance, but they're actually already athletes. These are not, normal members of. It's not like me taking steroids and then going and trying to run against runners. These are already good level and elite level runners who are enhancing what they do. And more from a fan perspective, I'm just like, that sounds pretty interesting to me. From a medical perspective, obviously, you got to be careful. One thing that comes to my mind is just the damage that you do by taking testosterone. There are a lot of benefits of testosterone. Like, I can reel off plenty in terms of body composition, energy levels, metabolism, blood work, all these things. But the downsides are it can kill your fertility off. So, it can stop you from being able to have children. It can cause blood thickening. So again, these athletes, and I always tell members of the lay members of the public who are just wanting to use steroids, I always say to them, these men have teams behind them of doctors who are watching their blood work. Do not try to imitate what they do, because you're going to get in trouble. So there's a lot to this.
So I'm interested now in a bit of your history and a bit of your sport participation.
Yeah.
So just tell us again, when as you were a lad and you were looking at what you want to do, what was your sporting dream?
My sport, like my interest, did you say? Sorry,
Yeah. What was the dream as a young lad?
My dream. I had a few dreams. It was really interesting because I had a few sports that I really loved. Obviously, in the UK, in the north of the UK, football was massive. I was a Bolton Wanderers fan, so I lived through the heyday of Bolton Wanderers, and then the decline.
There was a heyday.
There was a heyday, yeah. No comment at the moment, though. So, football was always big for me. I was a very, very kind of... My parents would say I was pretty hyperactive. I was very energy fueled, and when I was 4 or 5 years old, my dad decided, because my dad was very big in sport himself. He loved sport, so he put me into kickboxing. So I did Muay Thai for around a decade. I was there, multiple times a week. Never competed in it, but it was more of a learn discipline, behave yourself. The things that I put that into other aspects, and it kind of really mellowed me out. The dream was obviously football or some sort of kind of kickboxing or something. And then I dabbled in a few other mixed martial arts things, so like sambo, jiu-jitsu. And then somehow obviously that was throughout my teenage years, and then I started medical school, and I just I really kind of fell into strongman and powerlifting. It was really interesting because I'd been injured when I was younger through a car accident with a lower back injury. And I went to start developing some sort of like weight training program, and I went to see the strength and conditioning coach. And he's like my Mr. Miyagi. He annoyed me for months by telling me not to do anything significant. So I wanted to go and deadlift and squat, and I'd go into the gym, and all these guys were getting ready for comps. And I was like, I want to do this, and he was like, no. He's like, here's a kettlebell. He's like, you do this. Very simple things, and I was just getting bored. But I realized over time he built my core strength up. And then when I started to do this, the heavier lifts, my back was in like amazing shape. So I didn't get any injuries for many years whilst I competed. Then I went into the amateur stage because I seemed to have a knack for it, and that was it. So I competed in a very low level kind of amateur strongman, and it was fun.
Yeah,
it was very interesting.
Yeah, but I mean, to me, competing is competing. So you clearly had a gift for it, and I guess an enjoyment of doing the sport as well.
Yeah.
That competitive edge. Now, you were doing this sport whilst studying as well. So you were studying medicine. You were starting to learn I'm guessing, this whole journey around not just general health, but also what performance or how performance might be enhanced by certain drugs as well.
Correct, yeah. So you come across this, and you come across all like the black market use of androgens that aren't even, and I'll be honest with you, doctors aren't aware of, because even within testosterone deficiency, if you pulled up some of the doctors and talked to them about these kind of compounded drugs that people use, I have no idea about them, because they're not medical drugs. These are formulated by labs, and they're pretty complex in the way they work. So I was coming across certain things within specifically strongman, and it was because you got to a point where other people. I remember, to be fair, I look at it from an athlete's perspective, and this really like this was like a defining moment for me. I remember I competed in an open competition once, and I used to compete around 90 kilos. I wasn't really big. Some of these guys were massive. They were monsters.
I
So
think 90 kilos is quite big.
yeah, I mean, so I remember I had this conversation with my conditioning coach because we went in and I went into an open competition and I was the smallest guy there, and I didn't fare too badly in the competition. I finished not where I wanted to, but nowhere near where I wanted to. And I looked at it and I thought, these guys are really big. And I was around other strongmen who would then consider using anabolic steroids because they were like, I can't get that big and I can't get to the level that I need to then perform. So there is this thing within sport as well, which is there's people that are doing something I need to be able to kind of compete. And for me, I
That's
knew
right.
too much about the damage, and I never touched any kind of anabolics or anything because I just knew that it was not something. I mean, it wasn't my career. It wasn't something I was going to do long term. I didn't want to ruin my physiology. I knew too much about how bad of an effect they can have.
And so you didn't because you knew too much, right? You'd understood you understood the risks of it.
Yeah,
Could you understand the reward incentive for those, I'll say, fellow competitors around you who
yeah,
did take it?
100%. You'd see them try anything because it was an identity for them. It was, we're doing this. I have plans to be the best in the country. If I want to compete at a certain level, can I do this without? And that's something. And a lot of these guys were also working and things. But yeah, I always think, and I reflect on this. If they were aware of what I was aware of, would they still do it? And possibly they would, because some of these guys were just like, I have to do this, or I have to get to this level. And truthfully, we all know this. If you're walking around naturally at 90 kilos, the most I ever weighed was 103 kilos in my time. If I wanted to get to 120, and that's not 20 kilos of fat, this is 20 kilos of muscle mass. It's impossible. Anyone who comes to me and says, "Oh, I'll put on 20 kilos of muscle mass in a year or two," it's not possible. I'll be honest with you. I'm an optimist, ever the optimist, but that's pretty impressive to do that. That's pretty high.
Yeah. So I mean, it's interesting. So you turned your back on taking drugs in that way, ended up studying it, and if I'm right, becoming from an androgen perspective, winning awards indeed this year. Is that right?
Yeah, so I've been doing some data and stuff and collecting. So I received I went to the States just recently, actually, it was a few months ago, and I got the Emerging Scholars Award from the Androgen Society. And more so than the award,
Congratulations.
thank you very much. And more so than the award, I actually really enjoyed the experience. I went to San Francisco for the conference, and it's almost like when you meet, you're a child and you have a footballer that you idolize, and you meet them in person.
Yes.
I was there, and all these papers, and I know it sounds really ridiculous, but all these papers written by the top professors, they were all in front of me, and I got to meet them, speak to them, and I was just like, this
Yeah.
is the guy who wrote the paper on X and told us that there's no prostate cancer risk, and I
Yes.
was just like baffled that I'm just sat here having a conversation. So more so than anything else, the experience was fantastic, and I really appreciated all of the advice they gave me, and they're very welcoming. Like they were very nice.
Yeah. Oh, that is a wonderful experience. And, the fact you get to meet, well, to meet idols at any stage, I think is wonderful. And hearing it in your voice, it does take me back because as I've been doing my studies, must have been a few years ago now, I reached out to a couple of people who wrote papers that I studied. And I wrote them a note and just said, "Hey, thanks. Really enjoyed reading what you said." And one of them, she got back to me and I was really chuffed. I was like, wow, a real person.
Yeah,
This is fascinating.
it
So
is.
yeah, listen, I can fellow geek out like an
Yeah,
academic
exactly.
in the same way. So yeah, I'm with you. Um, so I mean, with that award, so you have this knowledge. I'm assuming you perhaps to some extent sought out, and I'm interested then for those individuals who made the decision to take some sort of performance enhancing drugs.
Yeah,
Do you have any case studies? Have you come across them who coming out of elite sport or competitive sport
yeah.
need your help to reduce it, come off it, normalize in some way? Is that a thing?
It's a big grey area, or it's a very stigmatized thing within medicine. So, for example, you will get you'll get some athletes, for example, who will have used steroids. So, a common ones are bodybuilders. Bodybuilders utilize testosterone. They utilize basically a lot of things, some really complex drugs. The problem that they have is they use for years. They use for a decade, 2 decades, and we touched upon this earlier on, which is you shut off your own production. So the way testosterone works, and this is really important for people to understand, testosterone is produced by the testes, and I don't want to go into too complicated a pathway, but the stimulant for it comes from the brain.
Simple for us.
What's that? Sorry.
Yeah. Keep it simple. Keep it simple.
Keep
But
it
yeah,
simple.
I'm keen to understand that.
Yeah, the brain stimulates the testes to produce testosterone. When you take testosterone and put it into your body, there's something called a negative feedback. So the brain looks and says, "Oh wow, there's loads of testosterone. I don't need to keep stimulating them." So the testicles shut down. So the longer you do that, the less likely it is that when you come off testosterone, or I'm sorry, not testosterone, but anabolic steroid use, that you can ever live a natural life without them. So you will see most men who have ever abused steroids will end up on testosterone replacement, and that's because their testicles just don't produce testosterone anymore. And as a doctor, the grey area here is a lot of these men come to me, and we, in both in the NHS and in private, and they will ask the question, they'll be very straight, and the people are very honest with me because I have no kind of judgment on it. I don't care if you use steroids; it doesn't matter to me. And they'll say, "Listen, doc, I'm on X, Y, and Z. I'm done. I want to come off them. Can you help me?" And on the NHS, the answer is no, because that's drug abuse. I can't help you come off things. So they're left to do it on their own. So then they turn to Reddit, and then they turn to people that they might know, and then they do things, and there's no structure to it. So my perspective on that is my opinion is I think that it should be something that we do, because there are a lot of men who are coming off steroid use, and I don't know the actual numbers, but we know specifically in the UK that the number of normal men who've tried anabolic steroids is significantly higher than we actually think. It's not in the 1 or 2%. It's actually very much higher, and this is in general during their lifetime. So these men need some hand holding, because there are some complicated ways of coming off testosterone. So once they're on steroids, you have to slowly reduce the testosterone amount that they're using, but then you have to build up another hormone called either HCG or clomiphene or N-clomiphene if you're not in the UK. And these are drugs that then stimulate the testicle and try its best to start working again. It's for me, I mean, it's not as complicated, but it is quite complicated. And then there's risks that come with it. So, you've got to monitor estrogen levels and so many other things that happen.
Right. And so I guess it's a thing, right? I mean, I said at the start, I'm going to be learning as we have this conversation, and the bit in my mind is I'm going to end this conversation, and then so many more questions are going to come, right? And I'm sure there are going to be many listening. They're going to want to reach out. We'll definitely come back to if they want to get in contact with yourself. But I guess I'm amazed actually that it's a thing. I'm amazed as a specialty. I'm amazed about, I guess, the awards you won, the conference, the things that have been written about this, because to me as an athlete, it's just been, I guess the whole use of drugs has just been a no, don't even go there. Everything batch tested, move forward, do that type of thing. Here, what we're talking about is, well, actually, sometimes there's a need, right? There is, as not as an athlete, but just as a man.
Yeah, as a man.
Yeah, as a man, this is something that I would need to consider, or at least it should become a normal thing in the vocabulary. to
Yeah.
say, given these types of symptoms, here's another way of thinking about what's going on, or what might be going on inside you, not just mentally.
I mean, one of the things that comes to my mind is, I think, the health benefits. People don't realize. So, if we go back 10, 15 years, there was a big push for HRT in women, and I think that's fantastic, because HRT, women weren't realizing that it's necessary and the benefits of it, because there was a lot of scaremongering and like, oh, be fearful of this cancer and that cancer. The same thing's happening in men's health. So, if you look at one of the common worries that a lot of men have with regards to when they talk about TRT, testosterone replacement therapy, is they'll always come to me and say, "Doctor, what about cancer? I've heard that prostate cancer is gonna, I'm gonna get prostate cancer." And the interesting thing is there was a study done called the Traverse trial in the States, which is basically quashed that. It's complete nonsense. I mean, they had to do a huge data set study to follow normal men and TRT like replaced men, and they found that the link, there is no difference in the prostate cancer risk. So this came from not even data. This idea came from someone's thought process that because prostate cancer can be driven by testosterone, it must cause it. And it's not true. So, if you look at the benefits are so much better on that kind of metabolism, insulin resistance, cardiovascular risk, so many things that when you actually get it into an optimized level, it will benefit you later in life. You don't want to be 60 and have a poor bone mass density and then end up on medication trying to retain that. So you want to try and hit it early and retain as much as you can whilst you're still well.
Yeah. And to bring this to athletes, those who are looking at their retirement, perhaps, or again, are that few years off, what advice would you give to them? If they're getting any sense of the symptoms that you've mentioned before.
The first thing to do is just get a blood test done, a full blood panel. Depending on which country you're in. I mean, in most countries, privately, you can get whatever panel you want, and that would include a full men's health panel. That includes things like total and free testosterone, your sex hormone binding globulin, estrogen, prolactin, and all your stimulation hormones. This gives a doctor the ability to figure out what's going on with your hormone health. And even if you have an inkling, or you just think, oh, maybe I feel something, just get it tested. Nothing bad comes of it. You get numbers, you figure out where you're at. And then if you are deficient, then seek out assistance early, because the dreaded thought of lifelong therapy, etc. When you've met someone on TRT who is truly deficient, they would never ever contemplate not having done it, because it changes their whole life.
I feel I've got so many more questions to ask, but listen, Zak, I've got to say thank you for bringing your perspective to me. Definitely teaching me a little bit more about this, and I suppose. Listen, I'm hoping through this conversation, those watching and listening are also going to start to normalize a little bit more about, I guess, testosterone replacement therapy, but
Yeah.
also to bring a different perspective as to what might be happening to their bodies as they come out of elite sport as well.
Yeah, I mean, the conversation is a starting point. I think it's not enough that's known about this, and it's a specialty in its infancy. I still believe. I don't think there's enough in it, and you're going to see a lot more doctors delving into the hormone specialism and andrology, and that's good. I'm happy. I think the more there are, the more options patients have to reach out to people.
Yeah, yeah. I'm thinking about testosterone. We've focused very much on men in this, and I know that's been your focus there, and
Yeah.
you've just now got me thinking about women, and all of those pieces. Perhaps that's a topic for another time.
I mean, it is. There's a lot of again, a lot of work being done in the utilization of testosterone in women. Not to the same extent, because women don't have as much testosterone free roaming to utilize. But there is a big topic around testosterone in HRT, which is prescribed in the private sector. In the UK, it is prescribed, and it works very well. So again, not my subspecialty, but a HRT specialist would give you a fantastic conversation about that and the impact it has.
Yes, indeed. Well, look, Zach, people are going to have more. People will want to reach out because through this platform, people will hear your name. People are going to listen to this story. They're going to at least want to delve a little bit. What's the best way to find you and perhaps to get in contact?
I mean, the best way to get in contact with me currently is probably through LinkedIn. I'm very active. I engage with many people, and I'm happy to have the conversation. I'm happy to give time because people reach out to me a lot about the unknowns of certain things. My answer is always just reach out, and I'm happy to get in touch and give advice and offer advice as best I can.
Zach, thank you very much for joining me on the show today. Really appreciated
Fantastic.
you sharing candid perspective and facts as well.
I mean, it's been a great conversation, and it's been great talking to you.